So the process that we will go through will firstly involve a hearing assessment, during which we'll ascertain where the problems that you have are and how we're going to try and solve them for you. Normally after about a fortnight, we will then fit you with the appropriate technology, and in that appointment we will go through everything that you need to know. Following that, we normally see our patients every 2 weeks, normally for 3 follow-up appointments, which is adequate for most. And then after that, we will expect to see you every 6 months, whether you like it or not, and that will include retesting and reprogramming.